Good day, Doc, and everyone. This is the collaborative work of Group 5 through the efforts of each member. So today we are going to tackle about PEIRIDDDEC. What does PEIRIDDEC stands for? PEIRIDDEC stands for Prevention, Early Identification, Referral and Intervention of Delays, Disorders, and Disabilities in Early Childhood. My name is Normie Amit, and I'm going to discuss the first part of our topic, and it will be continued by my group mates, namely Ma'am KRISTINE VILLACRUZ, Ma'am RITCHEL BULLAG, and Ma'am HAZEL GEPANAGA. Our topic includes introduction about PEIRIDDEC, its background, the linear system of PEIRIDDEC, and its expected results. Personality disorders are enduring patterns of behavior, cognition, and inner experience that deviate from cultural norms and expectations. These disorders, which often develop early in life, can have a profound impact on an individual's relationships, work, and overall well-being. Prevention, early identification, intervention of delays, disorders, and disabilities in early childhood, or PEIRIDDEC system in the Philippines with partnership with UNICEF or the United Nations International Children's Emergency Fund is a comprehensive initiative aimed at addressing the developmental needs of young children. This project focuses on early detection, timely intervention, and tailored support for children at risk of delays, disorders, and disabilities. There are sectors under PEIRIDDEC system which are interconnected and vital for individual development, community health, and societal progress. Both they are the education and nutrition sectors. The specialization of education sector is in early childhood, which has the following key aspects. First is the primary education, followed by the gender equality, then the quality education, the school infrastructure, and last is the community support. While nutrition sector is specializing infant and young child feeding. So, as we all know, nutrition is very essential for overall health and well-being. So, here are the key elements of nutrition sector. First, we have the nutrition education, which provides information on healthy eating habits. Another one is the healthful diet promotion, which encourage balance and nutritious food choices. The next one is the disease prevention, which educates on the role of nutrition in disease prevention. We have also the food literacy, which enhances understanding of food and its impact on our health. Then, the food sustainability, which addressed issues related to food security and sustainability. And the last one is the community health that promotes eating practices at community levels. The UNICEF, which stands for United Nations International Children's Emergency Fund, is the issuing agency which is primarily focused on humanitarian aid, child protection, health, education, and overall well-being of children globally. Personality disorders are enduring maladaptive patterns of behavior that can have a significant impact on an individual's life. So, understanding the types of symptoms, causes, and treatment options is essential in providing support and care for those affected by these disorders. The objective of this community-based system for the prevention, early identification, referral, and intervention of developmental delays, disorders, and disabilities in early childhood is to outline the flow of responses for Filipino children who are with or are at risk for physical and developmental delays and disabilities. The system seeks to equip early childhood care development providers at the barangay and municipality or city level. So they are the BHWs or the barangay health worker, or the CHWs or the city health worker. So with their knowledge and skills on prevention, early identification, referral, and intervention at their level, and maximize the access to improve the quality of existing programs and services for early childhood care development. So aligned with the United Nations Convention on the Rights of Persons with Disability, and thus in effect the human rights-based social model of disability, this system recognizes the critical challenges in the work for children with or at risk of developmental delays, disorders, and disabilities. The system has been endorsed for approval by the Early Childhood Care Development Council Secretariat in September 2019. This partnership is intended to help in operationalizing and demonstrating how the system works in different contexts. So, this is all about my part in this topic. And may we have Ma'am KRISTINE VILLACRUZ to continue with this discussion.
Good morning everyone. Good morning Doc DOMRIC. Okay, so today I'm going to tackle about the linear system of prevention, early identification, referral, and intervention of delays, disorders, and disabilities in early childhood from 0 to 4 years and 11 months. Okay, first, prevention. Okay, if we say prevention, it is the action of stopping something from happening or arising. Okay, so how can we prevent the delays or the disorders and disabilities in early childhood? Okay, first, no, so there's a youth counselors or CHWs counsel during the pre-marriage, pre-pregnancy, and during pregnancy. Okay, so as we all know, no, that there are counseling before you get married. No, there are counseling for the couples or for the those who are planning to get married, and also for those who are planning to get pregnant. Okay, so second, parents and primary caregivers do regular and or additional prenatal visits or checkups. Okay, as we all know, no, that those who are pregnant, no, they are required to have a prenatal checkups on their respectives of gynae or doctors, no, to ensure the health of their child, no, habang nasa tiyan pa lang, no, our parents or those who are parents, no, those who are mothers, no, they need to be healthy. They need to take medicines or what we call this vitamins, no, in order for their babies to have a healthy body. Okay, so third, the CHW screen. Okay, the maternal nutritional screening and intervention tools, no, to measure woman's stress level, witnessing or exposure to violence. Okay, nutrition, health, and etc. Okay, for those who are for those women, no, we are or they are should be in a healthy environment, or as we call this stress-free environment while they are pregnant. Okay, third, it is the the CHW's conduct risk management. Okay, the second one is the early identification of delays, disorders, and disabilities in early childhood. Okay, so if we say early identification, it is refers to recognizing any disabilities or developmental variation in early childhood, and it is the understanding the needs of early interventions. Okay, so how can we early identifies the delays, disorders, and disabilities in early childhood? Okay, first, the CHWs screen the newborn below 3 years old. The second one, the CHWs they have the health assessment, health and development of newborn child. Now, it is the development of below 3 years old, development of 3 to 4 years old, and 11 months. Okay, so after the screening of the CHWs or the assessment of CHWs to the children or to the newborn babies from 3 to 4 years old and 11 months, they assess the results to the parents. Okay, the fourth one is that the parents continuously monitor for red flags for development and delays. The systematic monitoring of children's early growth and development is essential for identifying delays, no? So there are red flags in the field of child development. Okay, these warning signs in a child's development need prompt attention and action, no? It is essential to know these red flags as forewarned and forearmed. Okay, however, a lack of ready accessibility and awareness of these warning signs in the children's development is hampering early identification and appropriate intervention for conditions such as ASD, the ADHD, dyspraxia, and more. So, it is complicated further when many parents wait for over 12 months from the time they first raise concern regarding their child's behavior or developmental to the time they receive an assessment or diagnosis. Okay, no? So there are some parents na hindi kaya or hindi na afford yung pag undergo ng kanilang mga anak ng newborn screening, no? Hindi lahat na-afford, no? So, hindi lahat ng delays or ng disabilities ng mga bata ay napupuna agad ng mga magulang. Okay, so parents often becomes aware of the fact that something just isn't right, no, with their children or with their child, but they decide to wait or to see if they will grow out of it. Okay, so nearly all parents are told only by friends, family, and even professionals to wait another 6 months. There are parents who are hindi alam kung ano ba yung mga signs or ano ba yung mga red flags if their child has a disability or there's a disorders in developing their children's health, no? Minsan mas nakikita pa ng ibang tao, no? So minsan nga mas mahirap pang mag-suggest or mahirap magsabi sa parents na that their child needs to see the specialist, no? Na nakikita natin yung that there is something wrong with the child, but the parents ignore or the parents insist that there's nothing something wrong with their child. So I have here some red flags in where we can see or we can early identify if the child has a disorder or the child has a disabilities, no, and their characteristic or their developmentals. Okay, this characteristic that might help us or to identify if a preschool, no, as we teachers in kindergarten or preschool, no, this might characteristic may help us to identify if our child has a developmental delay or disorder. Okay, first, if the child is consistent response to being called by his or her name. Okay, the second one, if the child is consistent response to sound and simple verbal commands. Okay, the third one, good response when instructions are given one-on-one but poor response when a general instructions. Okay, next, the instructions is given. Next is the speech is not clear or understood only by parents, no, those are the characteristic. Other one is the overactivity or hyperactivity, or it is the inability to pay attention, sit at a place, sustain inactivity as compared to peers. Okay, these are also the disruptive behavior in the classroom, no, for example, screaming, pinching, pushing, running around without apparent cause. Yun, yung mga batang na mayroong hyperactivity. Okay, next is the underactive or hypoactive. It is does not participate in the classroom activities like his peers. Okay, it is they not show interest or interact and with play with their peers. Okay, does not initiate activities or conversations spontaneously. Okay, they react inappropriately to touch, movement, sound, or like light. Or next is the child is poor in imitating actions and words. Next, seems to be in a world of his own and talks or laugh to himself. Okay, so meron silang sariling mundo. Next, that the child may have repetitive body movements. Okay, so iisa lang yung ginagawa ng bata, no, paulit-ulit, no, iisa lang yung kanyang gustong gawin. Okay, next, the child may show poor motor skills or seem uncoordinated during certain activities. The next one is that the child may not maintain eye contact and finds it hard to follow instructions. Okay, the last one, many children are thought to have a hearing problem with in fact they lack a receptive understanding. Okay, so those are the characteristics of the child that might help us teachers to identify if our preschool child has a developmental delays or disorder. Okay, so next are the CHWs, the CDTs, the CDWs, no, do not follow through assessment choosing other tools, no. There are also child observation guides, screening tools for developmental disabilities like ASD, the ADHD, and the ID. Okay, there are also tools for difficulty with seeing, moving, hearing, and communication, psychosocial parent concern, and questionnaire. So those are the tools, or those are the process on how we can early identify if our child, no, has a disorder or has a delayed in their development. Okay, so we have here the early childhood care and development, or we call it the ECCD checklist. Okay, we have here the first record of the child, which is from 0 to 3 years old. Okay, so it is called the socio-demographic profile of the child. No, we indicate, or the parents will indicate, the child's name, the gender, birth, no, the address, and also the information of the father, and also the information of the mother of the child. Okay, so the next one, the child's record number 2, no, it is the ECCD checklist child record, no, it is from 3 years, no, 3 years 1 month and up to 5-year-old, no. So it is the second, or the follow-up assessment of the child. Okay, no, so we need, or the child needs these records. No, we teachers need these records in order for us to record the development, or uh, the and the progress of the child's development. Okay, so those are the linear system of predicts, or the system for prevention and early identification of delays and disorders and disabilities in early childhood from 0 to 4 years and 11 months. So thank you, everyone.
Good morning, everyone. I am RITCHEL BULLAG. So, I am the reporter for Group 5. So, our topic, it talks about the prevention, early identification, referral, and intervention of delays, disorder, and disabilities in early childhood. So, a while ago, Ma'am Amit and Ma'am VILLACRUZ already talked about the prevention, early identification. So now I'm going to discuss you what is referral. So how about you in your mind? What is referral? So I will going to discuss that one further in you. Okay. So in the referral, we have the stages. So first, we have CHWS, CDTS, CDWS, report to immediate supervisor if the child obtained below that expected score in ECCD checklist. So what is CHWS? So that is Community Health Worker. CDTS is Community Development Technician. And CDWS is the Community Development Worker. So our task with these three are to monitor and support early childhood development. So here they were going to assess the child. When a child scored below the expected threshold in the early childhood care and development, or ECCD checklist, is the critical to report to their immediate supervisor for several reasons. So we have the several reasons here. So we have 5. So let me discuss you the first one. So we have the early intervention. So in early intervention, prompt reporting allows for timely intervention that can address developmental delays or issues. So here they were going to check for timely intervention and address what is the child delays, especially in their development. So next, we have the resource allocation. So supervisor can allocate necessary resources such as additional support, specialized care, and referral to experts. So here, there is a budget, or this is allocated money how to give the child additional support, especially their specialized care and care, of course, and the to refer to the expert individuals, just like for example the doctors. Okay, next we have the collection or the data collection. Consistent reporting help in gathering data to track development, trends, and assess effectiveness of existing program. So here you are going to gather the data, track all the development, or how you're going to test the child in order to have the effective intervention to the child. Next, number 4 is the parental involvement. So the supervisor can engage with the parents or the guardian to ensure they are informed and involved in addressing any developmental concerns. So of course, maybe first and foremost, you're going to address in the parents or the guardian so that you can explain it immediately how they were going to give the proper medication to the child. So next we were going to talk is the last one is the training and support for CHWS and CDWS, and supervisor can provide the further training and support to the field of workers to better address the needs identified in the reports. So of course, we cannot go on easily and medicate or intervene the child if we don't have the proper training. So we cannot say, oh, this child has syndrome or whatsoever delays. So we cannot easily conclude with that. So we need to have also the training in order to have the intervention to the child properly. Okay, so by ensuring the children who do not meet expected developmental milestone to reported and address promptly, the ECCD program can better support the health and development of the children and community. So that is the purpose of ECCD rather. So this is the care, how they care the early childhood development or the development of the early childhood. So next we were going to tackle about the CHWS, CDTS, CWTS referred to MSWDO. So a while ago we talked about how those three support or monitor the child, but this is the second tier. So children who obtain below to the expected score, so they were going to undergo with a second tier evaluation and administer again in the ECCD checklist after 3 to 6 months. So here they were going to go with the MSWDO. So MSWDO is have also or a step should take in. So they have 4. So first one is referral to MSDO. So if the child score below the expected level, the CHWS, CDTS, CDWS should refer the child to Minister the Social Welfare and Development Office MSDO. So as I told you a while ago, so this is the second tier. So after those process, so after they undergo with that and still the child they cannot easily track or have the intervention the child, so they were going to the second tier, so that is MSWDO. So the referral ensured to the more comprehensive assessment to conduct identified any underlying issues and plan appropriate intervention, so that the child to have the proper intervention if you're going to if that certain CHW, CDTS, CDWS did not meet, okay, so the expected score, so they were going to go through to MSWDO rather. So next, number 2 is the follow-up and monitoring. So after the second tier of evaluation by MSDO, so you need the CHWS, CDTS, CDWS should continue to monitor the child. So it doesn't mean that you already give it to MSDO, you're going to regret the child. No, okay? You're going to follow up the child development closely, so that you can involve regular check-in with the family and providing any recommended support and resources. So number 3, we have administering ECCD checklist again. So after the period of 3 to 6 months. So the ECCD checklist should administer again to the child. This follow-up assessment have to determine if there has been any improvement in the child development intervention, if it is effective. So the ECCD, we're going to go through and we'll check it according with their checklist. So they were going to assess the child if or determine if there is any improvement to the child. So if they're none, so they were going to change the intervention. So if it is not effective, so if they're going to go through, so if the child has development, so they were going to have the next path. So number 4, the documentation and reporting. So all findings and action taken should be documented, reported, to ensure there is a record of the child progress and any intervention provided. This help maintaining a clear, consistent approach to supporting the child development. So of course we need to document and report all the progress of the child. So it might be he or she might progress or develop, or the child will be stagnant. So if the child will be stagnant at that stage, so they were going to have another intervention in order to improve the child development. So next, the second year specialist RHU PHCS conducts second year evaluation. So here is we have the refined step to ensure the proper evaluation and follow-up checkup. So we have six under with this one, referral and to second year specialist. So when the child score below the expected level, so should refer to the child to the second tier. So you need to refer that one to the second tier, so which is the MSWDO, and then this specialist can be found in rural health units. So you can find that one sa rural health units or primary health center. So RHU, what we call, or the meaning of this is rural health units, while in the PHCS, so that is primary health center. So next, conducting the second year evaluation sa second year specialist or health care professional at RHU and PHR will conduct more detailed comprehensive evaluation for the child development. This evaluation aims to identify specific developmental issues and recommended appropriate for the intervention of the child. So we were going to go deeper, to study deeper the child. So number 3 is implementing intervention. What you're going to do, you're going to implement the intervention based on the evaluation result, appropriate intervention for the child. Of course, the support services should be implemented well to the child. So this may include medical treatment if needed with the child. So the developmental therapies, especially with those child with delays their body, so you need to have the developmental therapies or other specialized supports. So number 4 is the follow-up and monitoring. So just like I explained you a while ago, so you need to monitor closely, update the parents, followed all of the providing additional support as needed to support and follow up the child. So number 5 is the administering the ECCD checklist. After the period of 3 to 6 months, the ECCD checklist should administer again the reassessment. So they were going they were the proper checklist to assess if help determine rather if the intervention has been effective or and if further action is needed. So effective or still they will need to have the further intervention to the child. And number 6, the documentation and reportings. All the finding, evaluation, and interventions should thoroughly documented and reported to ensure this is the comprehensive records of the child developmental progress and action taken. So, by following these steps, so in the CHWS, CDTS, CDWS can ensure that the children who require additional developmental support receive timely and appropriate evaluation, intervention from the qualified specialist. So, we need to have the qualified and proper specialist in order promoting, thereby promoting better health and developmental outcomes. So next, let's talk about the third tier evaluation. So we have the second tier specialist, which is the RHUS, PHCS. So determine, need to refer. So these stages naman, so those rural health naman, they were going to refer to the third tier specialist, conduct with the third evaluation. So we have 8. Under with that, let's talk about the initial. So how the third evaluation will going to assess the child. So we have a structured protocol should be followed. So we have 8. First one, initial identification and referral. If the child score below expected level from the CHWS, CDTS, CDWS should refer the child in the second tier. So after that one, the second tier is the MSWDO, and after that one, these specialists are typically located in the rural health units and primary center health center. Next, second tier evaluation. Second tier specialists at RHUPHC conduct the comprehensive evaluation to identify specific developmental issues and recommended appropriate intervention. And number 3, determination for the third tier referral. Based on the finding for the second tier evaluation, the second tier specialists determine if there is a need to further more specialized evaluation. If necessary, the child is referred to the tiered specialist for advanced evaluation. So we have tier evaluation. So the third tier specialist who may located with a specialist of medical. So this is a very high na. So you're going to have the medical center or hospital who is specialized with a certain developmental delays for the for the children rather. So conduct in-depth assessment and diagnose any complex developmental disorder or condition. So these specialists may include pediatric, neurologist, developmental pediatrician, and others specialists. Number 5, implementation and advanced intervention. Depending on the result of the tier evaluation, specific advanced and intervention are recommended. This might include specialized medical treatment, intensive therapies, or other target support services. Number 6, monitoring and follow-up. Continuous monitor the child progress essential. So from the CHWS, CDTS, CDWS should ensure all the recommended intervention are implemented to those child. Next, number 7 is re-administering the ECCD checklist. Again, you're going to have, after 3 to 6 months, you're going to have the ECCD checklist should be administered again to assess the student if the student will develop progress or developmental progress will go on. So this will help evaluating the effectiveness. Next, number 6 is the documentation and reporting. So all evaluation, intervention, follow-up activities should truly documented to ensure the comprehensive records of the child developmental journeys and to measure taken support their growth. So, by adhering this structured approach, CHWS, CDTS, CDWS can ensure the child with developmental concern receive timely, appropriate evaluation, intervention, leveraging expertise and multiple levels of promote optimal developmental outcomes. So, now let's talk next, the children who are at risk, referred parents, caregivers, CDTS, CDWS, implementing stimulation intervention to boost growth, development, address developmental delays and disabilities at home and in the CDC. So, upon confirmation of disability, so you have to confirm the disability. So you have the CHWS, deliver definitive intervention. The parents, caregiver, CDTS, the CDWS, implement specialized stimulation intervention in the ECDS to boost growth and development, address developmental delays and disabilities. And next, CHWS, continue to promote TA to parents, adopt good health, nutrition, and stimulation, and monitor the household and community level. So, if you have the intervention to the child, so already refer to the child, so you need to have to monitor how their community, how is it their household. So you need to check it. And this is the note. So second year evaluation special examination conducted by specialists. So this is only for the qualified and competent individuals. So as I said a while ago, from the first year pa lang, you have to have the training so they can be the following: how to use the early childhood care development checklist. So we have that checklist in order how to identify those childs with developmental delays. So we have also the hearing examination. So they were going to test the child hearing. So how they can hear easily. So next we have the vision examination, because there's a child that what we called farsighted, nearsighted. So we were going to check also that one, and also the nutritional status examination. So how healthy the child. So the medical examination. So we're going to check the background of the child. So there is the qualified and competent individual. So they have their own checklist. So other as determined. Okay, so thank you so much for listening. That will be my topic for the group 5. I hope you've learned something with my report, and thank you so much for listening. Again, good morning everyone.
Good morning, everyone. My name is HAZEL Panaga. I will tackle the last part of our report in prevention, early identification, referral, and intervention of delays, disorders, and disabilities in early childhood, or what we are called PEIRIDDEC, which is the expected result of this program with partnership in UNICEF. This partnership will help achieve key output indicators of the early childhood education and health and nutrition outputs of the government of the Philippines. UNICEF 8-country program for children. Location of the implementation is in the Philippines. A. Northern Samar, B. Samar, C. Zamboanga del Norte, Cagayan de Oro, and last is Valenzuela. As of February 2020, expected results are the following. Output 1.2 result statement. The health system at national level and in select provinces are strengthened to accelerate equitable access to high-impact interventions for reducing preventable newborn deaths, early childhood illness, and disability. Indicator for this is data on CWD. IP in urban poor is used in the health sector policies, plans, and programs. Output 2.1 Result Statement. Government authorities have improved capacity to deliver inclusive, gender-responsive, equitable, and quality early childhood education. Indicator for this is proportion of focus. Municipalities, cities implementing the system of for prevention, early identification, referral, and intervention of developmental delays and disabilities in early childhood. This is the expected results of this program. Implementation of the system for prevention, early identification, referral, and interventions of developmental delays and disabilities in early childhood. Proposed government, UNICEF, civil society organization partnership. So this is the expected results of this program. The proposed roles and responsibilities. Designing of the partnership. In designing of the partnership, lead in defining key results and deliverables approaches and major activities to deliver the results of the partnership. Review the draft detailed program document to be submitted by civil society organization. Endorse final design of the partnership for approval by the UNICEF Partnership Cooperation Agreement Review Committee. And the implementation of the partnership, national level activities. Coordinate and manage the implementation of the following national level activities from designing to actual conduct. National training of trainers using Volume 2 of the system. Training of child development workers, child development teachers serving children 3 to 4 years old. Participants, Regional ECCD Focal from DSWD and DepEd. Representatives from Regional, DOH, and NC will be invited to participate in selected module sessions. Serve as resource person, trainers, and national levels activities. Provide inputs to the development of modified tools, training manual for ECCD workers catering to children below 3 years old. Review the revised/final modified tools and training manual to be submitted by civil society organizations. And 2.2, LGU level activities, UNICEF focus provinces, cities, and municipalities. Assessment of the capacity of LGUs to implement the system. Provide inputs to the development of tools for assessing capacity of LGUs. So they develop tools for assessing the capacity of LGUs to implement the entire system. Assess the capacity of LGUs including mapping of service provider. And orientation of stakeholders at LGU level. Serves as resource person during the orientation of key stakeholders at the provincial, city, and municipal LGUs on the system if needed. Provide inputs to developing key advocacy messages. Technical support to operationalize the system. Serve as resource person during the training of ECCD workers if needed. Monitoring of partnership implementation. So the participant in the regular monitoring committee deliverable. Submit quarterly progress reports, physical and financial. Document the process of operating the system, including good practices, challenges, lessons learned, and recommendations to strengthen implementation and focus LGUs and implications of nationwide implementation of this program. Coordinate the resolution of cross-sectoral issues and operationalization of system, especially those will require formulations of national policies, programs, and tools. So under the financial management, we have Review and approve requests of civil society organization for release of funds. Release funds directly to civil society organizations. Prepare and submit to UNICEF funding authorization and certification of expenses form to request for funds for 3 months implementations. So this is for financial management. They liquidate funds not more than 6 months after the receipt. So this is the expected results of implementation of system for prevention, early identification, referral interventions of developmental delays and disabilities in early childhood. This is a proposed government, UNICEF, civil society organization partnerships. So thank you very much. Thank you so much. This is the end of
Thank
our
you
report
all
in
for
Group 5.
watching
God
this
bless
here
everyone.
video.